I'm not sure if, I'm just sorry, I'm just checking because our next speaker is, I think, not quite arrived yet. And so I'm just going to do a check. And here she is. She did arrive. Thank you. I am going to now introduce somebody. Is Anna Pasco. And Anna, could you join me, please? Thanks, Anna. I rushed you this morning. Anna was very kind to join us. She's on the West Coast, and I'm just going to get rid of this. And so it's early morning for you.
Yes,
It,
about
we're
9:27
breakfast
in the
time almost.
morning.
Yeah.
No snow outside, thankfully.
Well, I'm in cottage country, Ontario, to kind of give a perspective, and it's snowing madly outside. Everything is white, so it's looking very Christmassy out there, which is
Oh,
kind of
that's
nice this time of year.
beautiful.
Yeah, yeah. I'd like to introduce Anna, and Anna, actually, I'm going to like you introduce yourself, but I am going to tell everybody that Anna was our winner of the Kidney Cancer Canada Award of Excellence in Nursing Care and Oncology. And I got to meet Anna just recently in Alberta, and when I attended the Canadian Nurses of Oncology conference. And this young lady was highly recommended by Dr. Miriam Suleimani out there at the BC Cancer Centre. So, Anna, before we have a chat, I'm just going to let you introduce yourself. And then I will ask you to maybe if you could share a little bit about yourself. And I'm not sure, do you have any slides or not? No slides today. No slides today. Well, we're just happy to have a conversation with you. So I'll let you speak.
Hello, everyone around Canada. It's really lovely to be part of this wonderful event. And I just want to say thank you. I'm truly feeling honored for this award, especially from an organization that helps so many individuals dealing with kidney cancers. My role at BC Cancer Vancouver is a mix of kind of navigating patients through their treatment as well as educating them and filling in those gaps of misinformation that they might be given. Because they see multiple people, it's hard to retain all this information in one go. So when new patients come in, I kind of center and ground them to help them understand their diagnosis, the type of treatment they're on, what kind of side effects they might experience. And then I'll work closely with the oncologist to check in on patients for them, call them maybe once or sometimes twice a week to kind of see where they're at with their treatment and if there's anything serious going on that requires urgent medical attention. So that's kind of a little bit of what I do in ambulatory care systemic therapy at BC Cancer Vancouver. And with Dr. Soleimani, I also help with the von Hippel-Lindau disease community. And that's a rare disease where most of those patients live through life dealing with benign or malignant tumors. And some of them can develop kidney tumors as well. This population is throughout BC. And I do offer nursing support virtually, like over the phone, to assess what they need, any side effects they're dealing with, and helping their surveillance, kind of similar to active surveillance with kidney cancers. Um,
Wow,
yeah,
that sounds
I can talk about myself a little.
sure. Yes, please.
Um, I look quite young, but I just turned 37 end of this October. And I live with my husband, Mickey. We live in Richmond, and we have a 2-year-old puppy named Frisket. He's a corgi, so there's lots of fur everywhere. So I do a lot of vacuuming, and I enjoy a lot of food, eating out, spending money, of course.
Yes.
And I like to play piano and dance.
Lovely. That's great. Thank you. Well, I just, Dr. Suleimani gave you such, rave reviews about what an excellent nurse you were, and the empathy and caring that you give to your patients. That that really stood out, I think, in the applications and you surprised me when you say that you call on a regular basis. Um, I think this shows the difference across Canada in the the possibilities of nursing care. I know available in BC, is very different than what's available in Ontario and very different, from the eastern provinces. So some of us don't get that luxury of, the follow up and the extra care that you provide. So it must be very time consuming for you, for sure. Um, yeah.
I find that because of my past nursing experience, I've
hmm
developed a way of prioritizing and time management.
hmm
Typically, like acute care medicine was a whirlwind of different craziness in itself. And
hmm
being in an outpatient setting has allowed me to kind of set boundaries of what I need to do and what's more important. The
hmm
biggest thing is making sure my patients are safe at home. And
hmm
I know our disjointed healthcare system makes it much more difficult for them when they're not sure whether to go to this hospital with a
Yeah.
wait time of 6 hours, or I can tell them, hey, actually, this hospital emergency room is at 2 hours window. Maybe go there instead. And that
hmm
will help them so much because it's a lot for them to undergo even deciding to go to the hospital for something. Uh,
Yeah.
and then I would even phone up the charge nurse at that hospital, give them a brief handover of what is going on for that patient, so that way they can be prioritized faster.
Wow.
Yeah.
That that sounds fantastic. I wish we had that, but that sounds fantastic. That's something that other provinces can aspire to. And
Mm,
we at Kidney Cancer Canada are certainly advocating for this same kind of treatment for all patients across Canada. Um, that's interesting. You brought up, and I don't mean to put you on the spot, but you brought up, telling your patient when they should go to the hospital. And,
yeah.
are there sometimes patients don't know when to call the hospital. Could you
Yeah.
share a little bit about, what triggers or what symptoms they might have when they're on
Yeah.
systemic therapy that they should be seeking doctor's care?
Yeah, some therapies can, as you know, like immunotherapies can cause some inflammatory responses,
Yeah.
especially like colitis or pneumonitis. So
hmm
inflammation in the lungs or inflammation in the bowels causing excessive diarrhea. So, for example, I followed a patient who started maybe their third cycle of immunotherapy, specifically
hmm
ipilimumab, nivolumab
hmm hmm
combination therapy, and they had reported about 6 to 10 loose, watery, explosive bowel
mm
movements in a 48-hour time span, and they had woken up feeling quite unwell, almost feverish as well. They had lots of
hmm
abdominal pain. They had reported maybe some blood in the stools as well.
Oh, yeah.
So, assessing them over the phone, I also needed to kind of speak to their family member to kind of
hmm
understand the whole picture. And
hmm
through that, I reported to the oncologist right
hmm
away and said, hey, this patient's quite unwell. They are showing signs of like a grade 3 colitis
hmm
diarrhea. And there is a concern that there is an infection going on as well. So, would you like to advise the patient to go to the nearest hospital? And most of the time, the oncologists are like, yes, thumbs up, and I'll send
Get
them on
them in
their
there.
way. Yeah.
Yeah.
So the oncologist that I work with trust me and the other nurses. We kind of work as a
hmm
team effort
hmm
because we're set up as a team-based care. Um,
hmm
we actually find that the doctors really rely on the nurses as the eyes and the ears, um, sometimes the hands, to kind
Yeah, yeah,
of follow their patients because their volume of patients they see is tremendous now,
right.
unfortunately. And it's hard for them to even make a phone call. So that's
Yeah,
one example of how I support patients when they're in a state that is critical and needing
yeah,
urgent medical attention.
yeah. Thankfully, you are there.
Yeah.
That's something you know, just in your speaking, that's something that we experience as Kidney Cancer Canada when we talk with our oncology nurses across Canada. Like, what a valuable, team player they are. And I have to say that we really enjoy going to Cano because not only because we get to present the award of excellence each year, but we find the nurses are so engaged in patient care. Like they really know their patients. They're very much hands-on, even if, they don't have the luxury of being able to do all the things that you do. So many of them go the extra mile and they're engaged in the educational materials that we have and like because they're so close to the patient and that's why we truly enjoy like being a part of that conference and meeting all of the women and men from
Yeah.
Canada that do what you do. So I can't thank you enough, Anna, for what you do on a daily basis. And I'm sure all of your patients truly appreciate. I had a little note pop up from Russell. I think you met Russell at the conference as well. He really
Yeah.
wanted me to pass on hello and thank you so much. So congratulations.
Thank
And
you.
we're so glad you joined us today just to give us a little taste of what you do. Thanks so
Thank you
much.
so much.
Okay, take care.